Hi there, it's Dr. Saira, and I am back for our weekly show called Ask Dr. Saira, where you get to ask me your questions about personal development, spirituality, relationships, psychology, and I'll answer them. And the purpose is really to help you just change your story so you can change your life. So this week, our question comes from Sim, and she says, people say I'm so depressed, or it's my anxiety, when they actually aren't clinically depressed or anxious. Can you talk about this? What is mental health? This is a really layered question, Sim, and I really thank you for it, because in our vernacular, in the way that we speak, we often say things like, oh, that's so depressing, or I can't believe, oh, I'm so anxious about that, or that's making me really anxious. And we're not necessarily talking about clinical depression or, a diagnosed condition of anxiety. What we're usually talking about is feelings. And so there's a difference between feelings and mental illness, right? So there's a spectrum of feelings that are healthy and encouraged if you want to have positive well-being overall. So things like sadness, fear, anger, joy, connection, like there's these different feelings that, yeah, good, I'm glad you feel that way because it's part of the human experience, right? And then there's when it's not just feeling. So if you could think of, say, let's start with depression. If you could think of depression as kind of on this continuum, right? So on one side is just kind of like your regular everyday sadness, and then it goes to a point of depression. Now, you might say you're depressed, but perhaps you're talking more about this side of the spectrum where things are hard, you're feeling a sense of hopelessness and loss, and perhaps you're grieving, and that's valid, and those are important human emotions. And many people will say, I'm depressed, when they're talking about that side of the spectrum. Clinical depression, however, is something very different. It's not about sadness. Clinical depression, if you think about some of the symptoms of clinical depression, there's a lack of motivation. There's more than sadness, there's often a numb feeling, like not really feeling anything at all, just this kind of numb, empty feeling. Perhaps a sense of deep despair or hopelessness. So it's a little bit different, right, than I'm sad because this thing happened. Clinical depression is maybe something happened, maybe nothing happened, and there's this deep pit that I'm in that I can't crawl out of just on my own, with my own thoughts and my own regular support systems. So I think that's important for us as we speak and as we kind of communicate how we're feeling, to perhaps try to find some different words, because depression and anxiety are now, seen as more clinical conditions. What are some other words you might be able to use to describe that feeling of feeling low or feeling scared? So perhaps you could say, I'm feeling low, or I'm having a tough time right now, or I've had better days, right? Because again, that for people who do have a clinical diagnosis of depression or anxiety, it can feel a bit invalidating when people who don't actually have that experience are saying, oh, I'm so depressed. Because you're not depressed. You're down, you're sad, you're maybe, like I said, grieving or going through some other emotion, but that'll pass, right? It's an emotional expression that's natural. Emotional expression. It's not an illness. It's not something's wrong with my brain and I can't actually process my thoughts and feelings. I can't regulate myself. I can't get myself motivated to have a shower. That's a very different experience. So let's flip to anxiety, because the question was about both depression or anxiety. With anxiety, similar, right? So you might be worried, you might be nervous, you might be stressed about something. Perhaps you're anxious about something, but when you say it's my anxiety, now you're kind of going over to that land of clinical diagnosis, right? It's my anxiety. So do you have a diagnosis of generalized anxiety disorder? Do you have panic attacks, agoraphobia, like what? And not to say that you can never use those words. There's no like language police coming around and like, hey, don't use that word. But it's worth considering, right, when we're using language. It's funny, when I was going through some sensitivity training, they were talking about these trigger words that we use on a regular basis and don't really even think about maybe their impact or maybe what we're really saying. So things like, oh, you're driving me crazy. Now, for somebody who has a diagnosis of maybe schizophrenia or these different like crazy diagnoses, that may be hurtful, right? To use that as this negative thing. I think there's been developments over the last 30 years in mental health and mental illness. And if you could see, again, mental health in general as a spectrum, right? So whether you have a diagnosed condition or not, you have a range of your mental wellness, just like you have a range of your physical illness. So some days you might feel really energized and enthusiastic and ready to go and have lots of energy. Other days you may be really tired. And so that's an example of a physical change in your body. Now, you're not going to say necessarily like, I have chronic fatigue syndrome, because you're tired, right? You're tired, and that's okay, and that's enough. Same is true with mental health. Some days you'll feel well and you'll feel up and you'll feel like connecting with people. You'll feel hopeful, and other days you won't. And if those other days kind of go on and on and on and you're not getting any relief from it, then it might be worthwhile to actually talk to someone, a mental health professional, to see if this is actually a condition that needs diagnosis. Because what happens in depression and anxiety is that there's actually something often chemically imbalanced in the brain. And so medications do help some people. Therapy helps many people. And so, then you have to go into getting a treatment plan for yourself rather than just like, oh, I'm so depressed for 17 years. So those are my thoughts around mental health and mental illness. And the Mental Health Commission of Canada has this beautiful model that they've developed called the Mental Health Continuum. And I'm going to put a link to that in the bottom of this video so you can have a look at what mental health looks like, whether you've been diagnosed with a condition or not. There are days, and they do it in a color code, so it's like green, yellow, orange, and red. And so what we're trying to do is we're trying to move ourselves over to the green and stay away from the red. And red is where they suggest like that's where you need like professional intervention. But many of us, like we might be in green right now during, if there's a big crisis, a world event, we might be more in yellow and orange. Like that's kind of understandable because of our environment. So another way to think about it, and as I wrap this up, is that anxiety and depression aren't necessarily based in some event that happened that it makes sense you're upset about or it makes sense you're scared about. They're something different than that. And for those who have lived with those challenges, it can be a bit invalidating if people say, oh, I'm so depressed, and they're not really. So those are my thoughts. If you know someone who's anxious or depressed, I would suggest reach out to them today, make a connection. And I'd love to hear in the comments below, what are your thoughts about mental health and mental illness, and how does that play out in your own life? So thanks for listening. This has been Ask Dr. Saira. It's your life and only you can live it. Thank you. Bye.